We're going to get into kind of a discussion between me and Katie on how to get the most out of your clinical internships and your CIs, right? Because I remember going on my internships, I feel like it wasn't even that long ago. It wasn't. Totally freaked out about how to get the most, how to impress your CI. So here we go. Without further ado, one of the first things, and this to preface, I asked a bunch of new grads and students like you guys are watching some of the biggest things that they wish they had known going into their rotations. And so this is kind of a summation of all of those things. One of the biggest things, first off, was setting initial goals. And so really emphasizing the importance of establishing personal goals, along with maybe something that, the your program is forcing you to do anyway. Discussing those interests in specific populations or cases, like your incoming students want to see, is big. One thing I do with my incoming students is I'll just be like, hey, I'm so-and-so. This is what I do. This is kind of what I see. What are your main goals? Like coming into this, for me, outpatient orthopedic sport rotation. Okay, I don't know. You probably had way more students than me because I'm still relatively new. So you could probably speak on this a little bit better.
Yeah, I think what I typically do with my students, and this is something that you may think about potentially requesting or seeing if it's appropriate, is I meet with my students off-site the first day. Okay, so we don't meet in clinic. I try to take students to a coffee shop so we can really sit down and talk about goals. Because if you don't know what you want, you're never going to get there, right? Because there doesn't exist. And this is the time where, we're in this healthcare profession where we're trying to give back to people.
Yeah.
But you also need to be selfish for yourselves in your learning so that you can help people in the future, right? So having an idea of what that looks like, and some of the questions you can ask yourself is, if this rotation is a success, it will look like blank to me. Okay.
Yeah.
It will look like I am able to take a patient from an evaluation to follow-up treatment sessions to discharges. It will look like I can do a thoracic manipulation flawlessly. Those types of, skill sets. And then I would also really encourage y'all to think about or ask yourselves, if this rotation is a success, what does that feel like? What do I feel like at the end? Do I feel confident? If I feel confident, what does that mean? Does that mean that I can leave work and I can leave everything at work and I'm not taking it home? Does it mean that I am vulnerable with my patients? Does it mean that I make connections with my colleagues and relationships that can take me further down the line so that I feel safe and secure as a new clinician moving forward? And then flip that script and ask yourself what it would look like if it were pure failure, and what it would feel like, what you would feel like if this was a failure. So defining both of those, success and failures, can be a really great starting point to bring that information to your clinical instructor.
Yeah, I think it also starts with kind of a self-reflection of, okay, I'm going to this site or I'm going to this clinical experience. What do I lack, or what do I bring to the table here? Like, yes, you're a student, but you still have strengths you're bringing in, right? Like you're still, like I'm learning with you. Like I don't know who you are, right? And I'm trying to figure out from a CI perspective how you're learning, best ways to teach you too, and where I can kind of foster your growth where you're not feeling dull, right? Like,
yeah. And then AJ, what's your next question that you had on the?
Let's see. We talked about preparing for the rotation a little bit. Part of preparing for the rotation, how would you feel from a CI perspective? I know you said bringing them to a coffee shop and kind of sitting down and talking to them, but would you recommend like students really, really inquire and really deep dive the populations that they're going to see and the diagnosis that they're going to, see in advance and really kind of like be in that headspace already?
Oh, I love this. I also love that this is turning into a Q&A and interviewing.
Well, we're going to go back and forth. It's fine.
I love this. Yeah, no, I really like this. So I get that all the time. That is probably one of the most common chatterings that I hear when I'm on site at Baylor University and people are talking about their upcoming rotations and how they need to take the break right before clinicals to sit down and look at all of their orthopedic notes or all of their inpatient notes. And I think, there's some there could be some value to it, but what I would really rather you do as a clinical instructor is just organize that information for that site so that you can reference it, right? It's my job to help guide you through and question you through your hypothesis-based reasoning and, red flags and the treatment-based classification, for example, for low back pain. If you can't rattle off all of the steps for the TBC, then I'm going to give you a smile and I'm going to tell you to look it up and come back to me. And the best thing you
Sounds
can have
all too familiar.
Yeah. Yeah, the best thing that you can do is just say, okay, I'm going to pull this up and I watch you do it in front of me. It's organized, it's quick, and we're able to go through that information together.
Yeah. I think one of the interesting things that one of my students actually was doing recently, my most recent student, I should say, was we would have those conversations, right? We were going through with a patient on a TPC, whether that's, low back or whatever. And he has a little notepad. And he's like, I'm like, well, you got to go look this up. And he's like, I'm going to look this up later, but let me help my patient and then I can come back to it. And so, I'm there like, I'm going to quiz you later. Just wait. But he has those little notes, those little jot downs. And it's not like he's got a thick notepad. It's just kind of like, hey, I want to look this up and I'll be able to retain it better once I kind of seek out that knowledge for myself. And so I kind of appreciated that a lot versus I have 20 notes of research that I'm just going to grind through. And I'm like, that's not going to make, you're going to go home burnt out. You're going to tell your friends that I gave you all this work.
Yeah. Yeah, I agree. Yes. So I think as a clinical instructor, that's what I would want you to prepare with. And I would want you to be able to come with an open mind and self-drive to look stuff up yourself. So if I say, I shouldn't always be the one to tell you, well, go look that up if you don't know it. You should take the initiative and say, I'm going to look that up because I don't know that. And that makes me happy because that's what we do in practice, right? Like if I have a question today, I have a patient with BPPV and horizontal nystagmus in the horizontal canal. And the guy just recently changed his sodium intake from like 3,000 milligrams to 500. And my colleagues, she was like, yeah, diabetics and hyponatremia, there's a correlation in hyperglycemia influence on that. And I spent the time looking it up, right? Because I've been practicing for 9 years, but I learned something new today because I looked it up. That's all I ask from my students is self-drive.
Yeah, 100%. And it goes both ways too. If they ask you questions and you're like, I haven't heard this new article yet. You're like, oh, I'm gonna go look this up later. Not right now, not in front of my student, because you gotta look like you know what you're talking about sometimes. But it's also a humbling experience to be like, I don't know what that is, and we can kind of like deep dive that together. So from a student perspective, being able to like, I'm gonna ask you this question, and then from the CI, like, if you don't know, you don't know, right? You don't have to pretend you know everything. Like,
yep, not at all, not at all. And then AJ, when students are trying to navigate how to engage with patient care, what's your biggest piece of advice for them to do that?
I think, and this is anecdotally for myself, is being genuinely curious with the person in front of you, right? Like, I think as students, you read your case vignette, you're like, okay, this is a lumbar case with high blood pressure, blah, 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 blah. And then when you're out on the clinical, you're talking to a person, right? And so really understanding who they are and where they're coming from will help you abundantly with their patient care because it already helps with buy-in. Like you're asking questions where you're genuinely curious on their answers, how they feel in X situation or with X exercise, right? And as a extroverted introvert, secretly, right? I'm giving this presentation. It's weird. But being able to just talk with somebody, like go like, so I don't have to ask you to be like to go talk to that person, and you just do it because you want to help them, and that's what you're in the field for. That's going to push you more in your patient care to navigate that patient care than knowing, the Maitland, the Maitland book or something like that, right?
Yeah, I think finding that connection point, and I, I don't live. I moved out to Texas from away from home, and I had this realization like 6 months in that I sometimes I see my patients more than I see my family. Um, and that's wonderful because humans are fascinating and they're a gift. I see a lot of my patients as a gift. If I'm having a hard day, um, we're professional and we don't necessarily tell them all of those things, but if I am, I look to my patients to find the gift of their presence to lift me up, and doing so through connection is
Yeah.
huge. Absolutely. Feedback.
Oh boy, here we go. I'm
Yeah.
I'm gonna answer this way different than you are, but I'm gonna have you go first on this one.
So the topic is openness, openness to feedback from your clinical instructor. It's not usually a question I get necessarily from students, but more of something I observe along the way. So very often, we're all high achievers and high drivers. That's how we got to this field. It's very easy if a clinical instructor asks you a question, a knowledge question, for you to internalize that question as a story that that clinical instructor thinks you are incompetent. I have been there. um, and my feed as a clinical instructor, what I do is I watch my students' body position, nonverbal language when I am asking them questions. And I will often preface my intent behind asking a question, so they understand where I'm coming from, and it's not necessarily a slight against their intellect, so to speak, because it can be hard. You're being judged and you're under a spotlight and a microscope and all of those things. So taking time to really reflect on what happens internally in you when you receive feedback from faculty or a clinical instructor. What sensations do you feel? Like, does your heart start to beat fast? Do you get sweaty? That type of thing. Just having that awareness that those are your smoke signals and your triggers of what happens, and then recognizing as a student when you get those questions, what emotions are you feeling behind it? What stories are you creating? And maybe that's an avenue to have an open and candid conversation with your clinical instructor. But at the end of the day, I want my students to feel safe learning, and I want all of you to know that I'm here to help you, not here to judge you, because learning is messy. It's totally messy.
Yeah, no, I 100% agree with that. I mean, as an overthinker, where I can still remember some off the cuff comments like a professor or a teacher has said to me like 7 years ago, I try my best, and I am a very blunt person, just in general. Of like, I don't hide it in my face very well. My mentor Whitney can attest to that. Um, but like you said, Katie, I want my students to feel safe and be able to be like, hey, come talk to me when they are having exhibiting those same things that I do, right? Like heart's beating out of my chest. I'm starting to get sweaty in my palms because I might not know the answer to this. There are times where your clinical instructor might want to be like let you sweat it out a little bit, but
Mhm.
we have to make sure. I feel, in my opinion, I feel like we have to make sure that the environment is safe, and that we're going to talk about this later anyway, right? Um, but that's from the trust earned and the open communication kind of upfront.
Yep, and recognizing your own learning strategies and preferences, and coming to the table with goals so that
Yeah.
everybody has an understanding of expectations.
Yeah. And to kind of slide into the next point here, it's you're gonna make mistakes. Like I you can probably name hundreds that you made in your first year in your internships. I know I did. I know I got kind of yelled at a few times, killed with kindness or not kindness, who knows? But it's really just understanding like you're new too. You're new to the profession. I'm relatively new to the profession still, and I'm still stumbling and falling, but understanding like from the student perspective, your clinical instructor knows that. Like they're there to catch you or not catch you. They're there to see, if you fall on your face in an eval or talking to a patient where you're trying to help them with a diagnosis or a pathology that they have, to be able to get picked back up and put on a pedestal to a higher level than where they were before.
Yep. And I think professionally, when you all finish your final rotations and you're entering the world of therapy, physical therapy, looking for a company that will support you in those moments as a new graduate, and then also as someone who's been practicing for several years, you want to have that team around you to lift you up when you need it. To give you the opportunity to kind of go into our next topic, which is self-care, to be able to provide a platform for self-care as well and support self-care.
Yeah, I mean, I might have overdone it my first year. Just let that be known, guys, from my first topic of conversation, that you need to have time for yourself. Like there needs to be a line between work and work activity to like, I'm going to relax. I'm going to be intentional about relaxing. And if you feel guilty when you're, sitting and watching Netflix on a day where you might have notes out, that's not relaxing.
Absolutely, absolutely. And having that, defining your self-care and your routines before you go into clinic.
Mhm.
And recognizing that sometimes self-care isn't necessarily an action, if that makes sense. So being
Yeah.
able to sit and do nothing and not feel guilty about sitting and doing nothing. It doesn't have to be going for a run. I had a very wise mentor tell me that sometimes just walking my dog is enough for that day in that moment.
Or drinking water.
Drinking water. Yes, drinking water is a big one. One of my rules in clinic is that my students have to have their water by them at all times. Absolutely.
Call it my security water bottle. It's fine. It's there.
Mm-hmm. Absolutely. AJ, is there anything else that that you gathered from your student group?
I think that one of the big things which I wish I had my last student do is go out and shadow a couple surgeries. I feel like if I get a student in early and they ask me like, hey, is there any opportunity for other professions where I can go learn from them? And Katie, you probably have a lot of connections there as well, where we can put them out and be like, you can go volunteer and shadow this surgeon, or meet this other professional that I have a relationship with. That's okay, just to get that full experience in whatever clinical setting that they're in.
Yeah, I absolutely agree. And we'll do in-house shadowing. So I have a certified lymphatic therapist colleague. So I'll send my student with her for the day and let the student observe her, or, sport specific or blood flow restriction if they need to go off site or hop on a Zoom call with, I've had my students hop on with sports medicine PTs as well. So people like AJ, that type of thing. And I've
Yeah.
taken calls from some Austin clinical or some Austin students too. So seeking your own kind of pathway for that. Don't be afraid to ask.
Yeah, 100%. But I think that is it for us. Obviously, it's just communication, right? Be open. We're here to help at any time, especially when we have students. We want students because we want to foster that next generation, right?
Yeah, absolutely.